making steady progress in reproductive health and also maternal health, but major gaps are still putting mothers and newborns at risk. A new national assessment under the Empowerment Program shows that family planning use has doubled from 18% in the early 2000s and to about 38% today. More women are delivering in health facilities, rising from 60% to 86%. Children's survival has also improved significantly, with under 5 deaths dropping from 151 to 52 per 1,000 live births, and infant mortality falling from 88 to 36. However, despite these gains, maternal and newborn deaths remain high, and maternal mortality stands at 189 deaths per 1,000 live births, far above the global target, while newborn deaths remain at 22 per 1,000. Experts say that the bigger challenge is no longer awareness but access. Many women know about family planning, but the barriers like cost and also long distances to health facilities, stigma and inconsistent supply continue to limit the usage, especially among young girls and also the unmarried women. Health facilities are also under pressure, facing shortages to staff, medicines, and also the emergency supplies. Only 38% of women reported being satisfied with the care they receive. There are also strong regional inequities, with higher teenage pregnancy rates reported in areas like Busoga, Lango, and also Bukedi. Health experts are now calling for urgent action to improve the access, strengthen health systems, and also ensure quality care for all, especially among the vulnerable groups. Now, moving on to our next story for today. Untreated STIs linked to rising infertility in Mayuge district. Health experts in Mayuge district are warning of a growing infertility crisis driven by untreated sexually transmitted infections. During a recent 5-day medical camp that happened at Mayuge Health Center 5, over 500 cases of STIs, including gonorrhea, syphilis, and chlamydia, were recorded. Doctors say that many patients are seeking treatment too late, with some women living with symptoms for up to 5 years. By then, the infection has often caused serious complications such as pelvic inflammatory disease, which can lead to infertility due to the scarring of the uterus and also the fallopian tubes. Men are also affected with untreated infections, reducing the sperm quantity. Health experts describe the situation as a silent crisis, warning that many people are unaware of the long-term effects of untreated STIs. One of the major challenges is that often one partner seeks treatment, leading to repeated infections between the couples. Experts are also urging couples to seek treatment together and either abstain from sex or use protection during the treatment period. And they are also calling for sex education, especially among the young people, and encouraging the public to seek proper medical care instead of self-medication or traditional remedies. Health experts warn that untreated infections like syphilis can be dangerous during pregnancy, increasing the risk of miscarriage, stillbirth, and infection of the unborn baby. The call now is for stronger community awareness, routine STI screening, and also early treatment to prevent long-term complications like infertility. That's what happened at the health camp in Mayuge district. Now, moving on to our next story. Uganda has introduced AI-powered portable ultrasound to improve maternal care. Uganda has taken a major step in improving maternal health care with the introduction of the AI-powered portable ultrasound devices. The Ministry of Health says that the new technology will help frontline health workers detect pregnancy complications early, especially in rural and hard-to-reach areas. Currently, only about 28% of pregnant women in Uganda receive at least one ultrasound scan, despite the medical recommendations. Yet, up to 15% of the pregnancies develop complications that require the early detection. The handheld devices are portable, affordable, and also powered by artificial intelligence, allowing nurses and midwives to perform the scans and interpret results without advanced radiology training. Health officials say that this innovation will reduce the delays in the diagnosis, improve decision-making, and also ultimately save many lives. The device also allows images to be stored and shared remotely, enabling health workers to consult specialists in referral hospitals and also strengthening care through telemedicine. More than 300 health workers have already been trained with plans to detect that number by the year 2026. Midwives on ground said that the technology could be life-saving, especially during the emergencies and the night shifts when access to diagnosis services is limited. Uganda now plans to expand the rollout to more health facilities, particularly in rural areas, as part of the efforts to reduce maternal and newborn deaths. Experts said that this could mark a turning point in bringing life-saving maternal care closer to women across the country. Now, moving on to our next story, maternal health awareness, a call to break the silence. As the world marks the Mental Health Awareness Month, health experts are reminding the public that mental health is just as important as physical health. According to the Ministry of Health Uganda, mental health plays a crucial role in how people think, feel, and also cope with their everyday life. At Butabika National Referral Hospital, specialists continue to emphasize the need to break the silence around mental health challenges and also encourage people to seek help without fear or stigma. This year's message focuses on opening and encouraging conversations, supporting one another, and also recognizing that seeking help is a sign of strength, not a weakness. Experts say that the more we talk about mental health, the more we normalize it, and the more lives can improve and be saved. And that's the call from the Ministry of Health, and as we start this month for mental health awareness. Now, moving on to our global story. Scientists discover that coffee surprisingly has an impact on the gut and also the brain. Coffee may be doing far more than just waking you up. A new study from the University College Cork has revealed that coffee can actually reshape the connection between the gut and the brain, affecting mood, stress, and even memory. Researchers found that both regular and decaffeinated coffee can change gut bacteria in ways linked to better mental health. This study shows that the coffee drinkers experienced lower stress levels, improved mood, and reduced symptoms of anxiety and depression. Interestingly, decaffeinated coffee was found to improve learning and also memory, suggesting that coffee benefits go beyond caffeine. On the other hand, caffeinated coffee helps boost alertness, focus, and also reduce anxiety. Scientists say that this is linked to gut and brain axis, the communication system between the digestive system and the brain, which coffee appears to influence in multiple ways. Experts experts are now believing and alerting the public that coffee could play a role in supporting both digestive and mental health when consumed in the right moderation. Those are our updates for today, and to our dear viewers, thank you for tuning in. We are going to move into our expert discussion, but before we head there, let's take a short break and then we come back with more. Our dear viewers, and welcome once again to your trusted health show here at TV1, and I would like to welcome you from the news updates. Now we head towards the expert discussion that we have every after we finish the news, and today we are going to take a deeper look and a dive into the conditions that affect many people but are often slightly seen different, and this is none other than peptic ulcers. From the persistent stomach pain to the discomfort we feel after we take meals, ulcers can disrupt our daily life if not managed properly, and it can lead to some serious complications. But what really causes ulcers, and is it just food or stress or something more? To help us understand more, we have been joined by an health expert, and we had him one time here at TV1. Now he's back here again to help us understand more about this cause, and this is none other than Dr. Josiah Kizito. He's not just a medical researcher with experience in multiple areas. He also has experience in nutrition and also sports medicine, and he has presented in research at international medicine conferences, and he has also worked around several countries, that is South Africa, Germany, to mention a few, bringing a wide perspective for today's discussion. And he's to join us and break down what exactly are ulcers, how can we handle them, and how can we make our lives better with making the right decisions. You are most welcome, Doctor.
Well, thank you very much, Madam.
Thank you.
Thank you for inviting me here today.
Okay. How are you feeling today?
No, I feel better. I feel better, and I am enjoying Kampala.
Okay.
I like the environment of Kampala,
yes,
though it is a very squeezed place.
Okay. So, Doctor, to begin with, let's start with your experience. We have seen that you are a medical researcher. You have represented the country in many countries. How has been your experience?
My experience starts with me when I was studying in Ukraine.
Okay.
That is Kiev. I used to be in a international university, invited by the other international sportsmen. In fact, incidentally, I had ulcers, 1986.
Okay.
86 was a bad year for me. I got affected by Chernobyl. That was a nuclear reactor. Chernobyl, that was a nuclear reactor which had an accident.
Okay. In Ukraine?
Yeah, in the Ukraine. Okay. I was the Ugandan who was involved in that accident. I used to run towards Chernobyl every morning.
Okay.
That morning I saw people
dying.
Naked.
Okay.
Yeah, because they were getting them from their houses to the buses without touching money, cell phone, going through a bus.
What a rough experience.
Right to the bus.
Okay.
But I came back to Uganda because I was sent by the government.
The government brought you back?
Yes, to care after me. I thought I would die quickly.
But here you are.
Here I am, and the Americans, doctors have come to look for me in Uganda, even to South Africa. They say, it comes you are affected by the radiation, but you manage to get children. So the doctors have been able to me, not only the doctors from America, but is that I'm on the Google. They are talking about me that artificial intelligence.
Okay.
When you go to artificial intelligence, is always talking about me, how I have survived, and I feel I feel better to talk to the people, to the public. So I had ulcers in Ukraine, admitted, but one of the things which affected me as a young person, I used to take a bit of vodka.
Okay.
It was eroding my stomach. But if I go to scientifically ulcers, I would say that Uganda is highly affected today.
Okay, if you are to talk about the epidemiology, sorry for that, how do you state it for Uganda?
For Uganda, they say 1970 and compare 2026.
Okay.
You get me? There are reasons why the ulcers have increased.
It's not decreasing, it's just increasing.
Yes, it's increasing.
Okay.
And they say more than 60% of the people
are sick
with ulcers. I've been going to the people around Kampala, young people, children, border riders, market women, gold miners, students, and office workers.
Okay, they are sick.
They tell me, but I can tell you today, if somebody takes my trend, after 1 week,
they can be fine.
They can be fine. We shall have no ulcers in Uganda.
Okay.
Might be 10 or 15%
of the people have
of the people, because when you do research, you see what brings them, what is the cause.
Okay, so doctor, before we dive deep into ulcers, the discussion we have for today, what has inspired you to go into research? Because we have seen in your experience you went to South Africa. I heard that you also met the President Mandela. What has actually inspired you to be there? Because you even received a huge attack in Ukraine, as you have said. What has brought you to that line for medicine?
I did a lot of research. I've been to countries which do a lot of research.
Okay.
Ukraine, Russia, and Germany, particularly Black Forest.
Okay.
And apart from that, I was involved in an accident of nuclear. And when I came here, that was 1986, Uganda supported me.
Okay.
In fact, they refused to give me the money because the other students were suffering, but it was decided by the parliament. The government sent me $3,000.
Okay.
That time, people were saying, "Wow, can you send big money to a person when we are just coming from a war?"
Of course.
It went to the parliament, and I think the permanent secretary had the problems to explain until we went to the parliament. The ambassador was instructed from the parliament to pay me immediately, of which he did. And I went to Germany because I was the person affected by the nuclear.
Okay.
And when I went to Germany and other countries, while I was getting treatment, I was very interested in research.
Okay.
To know about my health, my life, health for others, and people were really following me.
Okay.
I knew that I was not going to survive for so many years.
So you decided to go into that?
Yes.
Okay.
And I was also pursuing science in those fields.
Okay.
Yeah.
You know, those areas, they have big hospitals, and it's such an inspirational place for treatment related to the type of hospitals we have here in Uganda. So, okay, when you say that, we can understand. Okay, so let's get back into our day's topic. What are some of the major causes for ulcers, and how would you explain ulcers, like in your normal terms?
I'll talk, I'll give places where ulcers attack and where they are more dangerous.
Okay.
And also, you see that it erodes, the outer part of the covering as you go down the stomach.
Okay.
The mucous membrane.
Yes.
Once it is eroded, anything you will touch that tissue directly without protection.
Yes.
And where do ulcers start from? And which trend do they follow? Peptic ulcers, you'll go to the stomach. But other normal ulcers, we get ulcers under the tongue.
Okay.
Some people have a way of biting. We have ulcers in the mouth.
Okay.
In the gums. Some people, they bite themselves.
Those are still ulcers?
Yes, they will get ulcers.
So it's
but not
the wounds that are inside our body?
Yes.
Okay.
Then they are still called ulcers. Then you go to the throat.
Okay.
Also, some people, they come in the form of wounds. Some people become uncomfortable. I've seen people saying, I always,
cannot talk.
Under my tongue, I'm always uncomfortable.
Yes.
Then we go really to the esophagus. We have ulcers, the real ulcers of the stomach.
Okay.
Then from the stomach we go to the esophagus. That is a tube which goes to the stomach. The beginning of the stomach, we have another type of ulcers. Then we go to the middle of the stomach.
Okay.
We have, but the real danger, 75% of H. pylori ulcers, they are in the duodenum, immediately after the stomach. That's where the acid attacks.
Yes. Okay, that's where it comes from.
And people don't sleep when they have that part. And from there, you still go down, but you find that the one I've told you, the one immediately, the duodenum from that first part of the stomach, because it is the C-shaped.
Yes.
You find that there is one horizontal, that's one who has a lot of ulcers, then vertical, and again horizontal. Okay. That's where we are very much interested. Okay. But we shall see what brings
ulcers. How does someone start developing the ulcers?
Pollution of water.
Okay.
Water pollution bring nitrates. Nitrates are there. Okay. Microplastics, they weaken the stomach barrier. Okay. And gets eroded. Okay. Because of the things they throw in the water. Some people are taking water which is not well refined.
Bottled water they still.
Yes. People are drinking water in Kavera. Okay. Others, they use you are not supposed to use the bottle twice. Plastic water.
They encourage recycling. After using the bottle, it's recycled again. Is that also a problem?
That one, they are renewing the material. Okay. But you find a person bought a plastic of Renzori.
They keep it.
He keeps on putting in more water, using it for juice. Child is going to school. Is not supposed to be like that, because some plastics will integrate in the material, small plastics, because plastics breaks down to minor places very easily. Okay. So you end up taking plastics. That is in water.
Issue we are having as
yes.
Today.
Then we shall look at also food pollution. That is called aflatoxin from molded food.
Okay.
And also we get it from pesticides on vegetables. That one, when it enters, even if you cook it, sometimes you take salads from the veg, we like a green salad. Yes, they are already, there's a bit of pollution there, as I've told you. It will affect the lineage. And people will not know. It becomes acidic. So we have seen pollution of water. We have also seen pollution of food.
Yes.
People are busy working, going to work every morning. They don't notice those things.
Yes.
They are taking children. Kampala is congested. And there is also a bacteria called H. pylori. That one is terrible at the duodenum. Okay. That's where it affects more. I've told you about ulcers. It is not there in the mouth, but there in the duodenum, it is, yes. The affection, it affects 70%. Of the duodenum. Yes. Okay. Now, that one, it makes worse when it mixes with other things, as I've told you. Yes. The pollution, water pollution, and also there is air pollution also. Okay. Will affect, like in Kampala. In fact, they advise people when it is heavy traffic, somebody to put on a mask. Okay, because they inhale in germs. Exactly. Okay. And that one will activate. So, doctor, does lifestyle also a factor to causing ulcers? Lifestyle, the daily lifestyle of people. Yes. Does it in any way also that's what contributing factor? You are talking well. I've not seen Kampala. Some people rest 3 hours within 24 hours. It is very interesting. Does that even rest? A person is supposed to rest for 8 hours. Right? Somebody is supposed to rest 8 hours. When you sleep, you wake up after 45 minutes to see where you are. You go back to sleep. And then after another 3 hours, you come up a bit naturally. And when it is coming to dawn, you wake up to see, is it really time for me to wake up? Those are the types of hours when somebody should wake up. Okay. Next time I should bring you a topic called sleep management. Yes, sure. There is a big book concerning about sleep. Because out of 24 hours, 8 hours somebody is supposed to sleep. What should the person do within those 8 hours? And somebody should not eat food before he goes for sleep. Okay. The food is going to be, if it is acidic, it is going to be in the stomach and affect the mucous membrane. Those are things we need to look at. To study and understand. Then there are those tablets, what we call NSAIDs, Panadol, aspirin. When people get pain, they want those tablets. You know, nowadays we are having an issue of people doing self-medication. Exactly. So if you talk about the Panadols, those are some of the things people normally buy for themselves. Yes, we call them. So it's also a contributing factor. A contributing factor. We call them NSAIDs. Somebody is taking them on empty stomach. Okay. When you take them, eroding becomes faster because they are also acidic. Yeah. Particularly in the stomach. They also increase stress. You get me? As they increase stress, ulcers also increase. Develops, yes. Yes, pollution makes ulcers bigger, deeper, and also you find that it is harder to treat them if they reach that condition. Okay, so doctor, to continue with, we have seen the causes. I want to put on 2 more. Okay. Heavy metals cortisol spike, hormone, stomach becomes less blood flow to the stomach because of cortisol when it spike that hormone. So I've told you the heavy metals which are disturbing us mostly here is arsenic, lead, and mercury. We get them from the things we use. Some women, I'm happy that you are not using the shining lipstick. Some of which has a percentage of mercury. And the other, they do it ignorantly, but when you are ignorant, it is it's not.
Ignorance is also.
Yes, price of modern ignorant living is suffering.
Of course.
You should not say that I don't know. So we need to know about heavy metals. Lead, where does it come? Mercury, how should we remove it from the body? When you treat the ulcers, and when you are still taking these heavy metals, it will come back again. So those are some of the causes of ulcers, the sleeping, not enough rest, the pollution around the city, and somebody goes and takes Waraji on empty stomach.
Of course, it will burn the stomach.
Exactly. The food we eat, I've seen people taking chapati the whole day.
Oils.
Yes, oils will also increase. And the oil, when they are using it, they are used several times. Somebody making chapati is going to use that oil even 20 times because he wants profit.
Of course.
He keeps in a bottle, he brings it back the next day until he sees that it's finished. You don't blame him or her because he needs profit. You need to educate him.
Of course, so that he can understand and maybe serve others.
Exactly.
Okay, so doctor, to continue with, who is mostly at risk of developing, if we are to look at the age groups we have?
First of all, young people, I've seen most of the younger people riding borders. They are a bit careless. They are careless.
Of course, on their lives.
Yes, they are careless. They get enough money, but after that they enjoy drinking on empty stomach. Market women also are involved, though they are selling food, but
still they are exposed to pollution.
Exactly. Then gold miners, people in Kasanda, I've seen Busia, Kalamoja, because they are using mostly mercury to purify
the
gold. Yes. And that water they must get a place where they empty it. They end it, leaving it to go to the rivers. And the rivers send it to Lake Victoria.
And people take the cycle.
Before the people take the fish.
Take it first.
Yes. And when you eat the fish, the cycle continues. So they have to know where to dump. It is a very good business for people to, because they are not using a factory or industry, so they must be helped to see how they are dumping that waste. And I've talked about students. They don't eat enough food.
Food at school.
And also some of the office workers. They
are so busy. They don't have time to eat.
They don't have time to eat. But if you have food, you don't need to take very expensive food. In some books they say you can use even dodo, which you get from.
Just like, then it's enough.
You mix it with other foods, balanced. Not eating miri or posho, morning, afternoon, morning porridge.
Posho, afternoon.
And evening.
Rice.
Yeah, you need to balance.
The diet.
We have a lot of food in Uganda. Almost better than
other
countries.
We
don't need just to pollute it, but we need to use it properly. It is cheaper use balanced diet, and also use clean food.
Okay, so we just need to know how to properly utilize the resources we have.
Yes.
Okay.
Yeah.
So thank you very much, Doctor. For our dear viewer, thank you for being with us till now. We are still continuing with our discussion, but before we go any further, let's take a short break and then we come back with more. Okay, so that's when they were cutting for the break. So we are going to. Welcome back from that short break, and thank you for tuning in. So we're still talking about your health show, and we were talking about ulcers in particular, and we have Dr. Josiah Chizito, yes, with us here in studio, and before we left, we were still talking about who is mostly at risk of getting the ulcers. And to continue, let's go straight to the symptoms and sign. What should people look for to know that, you know what, now I've started getting the ulcers?
It is around midnight, some people, when they fold their stomach in a C shape, when they feel pain, okay, sharp pain. And apart from that, you find that some people start losing weight.
Okay.
Unnecessarily, without knowing why they are losing weight. Ulcers, when they come, they can also make you to lose appetite.
Okay.
Because every time you touch food, you fear to put it in the mouth.
Yes, sure.
And I told that when we are talking of peptic ulcers, we must not forget ulcers right from the mouth.
Yes.
If you have sores in the mouth, ulcers, you fear to eat, you fear to chew. Yes. Okay. All those are signs of ulcers. And also when you are going to the toilet, your stool starts to look black.
Okay.
It starts to look black. When you are going to the toilet, you must notice, is it black? Are you going to the toilet with small things like that of a goat? Okay. You know that there's something wrong. Yes. It must be horrible. When you are going to the toilet, you must enjoy going to the toilet. Okay. You must not have sores when you finish those small things, because the opening behind starts becoming narrow. Okay. That's why you are going to pass small things, dry and painful, and also dark. Okay. Those signs will tell you that no, there is something. Something is wrong with me. Yeah, if you are clever, you start seeing a doctor. Okay. You take enough water. Even after taking enough water a day, a person is supposed to have 8 glasses of water a day. You still find the same thing. Okay. Sleeping, you don't enjoy food, appetite is not there, and those are some of the things you can look at to see that. I think let's talk about the stomach pain, because we see most of the people, when they receive a small stomach pain, even though it's mild, they will say that, you know what, I'm now having ulcers. How do we relate with the stomach pain and also the type of ulcers? I've told you that those type of pain is the acid is near the duodenum. Okay. That is the part immediately after the stomach. Okay. The duodenum is a C-shaped. It starts the first line. Okay. That's where there is much more acid. In fact, after that part, the vertical part is not acid. It is producing a hydroxide. Okay. Which means it helps a bit to neutralize the acid. The biggest acid is there immediately after the stomach. Okay. And you'll feel it at night. That's why when you eat late, it is a disadvantage to you. Okay, because it is going to affect you when you are sleeping. The digestion is not full. The first part after the stomach is an acid. The second part has a much of a bicarbonate.
Okay.
So whenever you go to sleep, you touch, you bend.
You feel that.
Those are signs. Appetite. When you are eating, you are not swallowing well. The speed decreases. Going to the toilet, I've told you, when you are at the toilet, you are not even comfortable. I've told you that toilet is part of the process of a human being. There is nothing ashamed of going to the toilet.
Yes.
Even the doctor will ask you how many times you go to the toilet.
Okay.
Do you have constipation? How many times do you go there? You have to answer well, and if you have constipation, you need help.
Okay. So can ulcers exist without the symptoms?
Without what?
The symptoms. You don't feel anything, but then you have the H. pylori is there.
You'll get those symptoms.
So it can't happen.
They are really very, even if you are a fat person. You know, being fat is just the hormone. I had a lady in Russia. She said, no, I want to stop getting fat. She started eating biscuits. Yeah, when you are getting fat, even just a bit of eating will affect the hormones. The hormone goes to the body and the body gets fat. It doesn't mean that you need to eat a lot of food.
Okay.
It is the way how you control your eating and the way how the hormone is balanced.
Balance with it.
So really the symptoms come. Even you see the person who is having the ulcers, the change of the face. I can look at even the eyes.
And you notice that this person is suffering.
Yes.
Ulcers. Okay.
Yes, you will see. I've done that study called iridology. You see the person and you know
that this person has
ulcers.
Okay, so what are some of the danger signs someone should look for?
Those signs I've said, not sleeping, going to the toilet.
Okay.
But the good news is that today, if we work on it in Uganda, after 1 week,
you'll be okay.
You'll be okay.
Okay.
Because there are things we can do. These some of them which you might not have been aware of.
Okay.
Taking an orange in the morning.
Orange. I think they say oranges have acid. So how does that?
It have acids, but there is more advantage because of vitamin C. Stomach acid stops burning. Immune system fights it.
Okay.
It fights H. pylori. 7-10 days if you are doing it, less pain after meals.
Okay.
We have different types of oranges. There are oranges which are very expensive. In fact, they are grown, I think, in South Africa or Kenya.
The ones that are so orange.
Yeah, when you are taking it early in the morning when you wake up, use it.
Okay.
Just eat it, not just squeezing it.
Okay.
People know how to eat an orange very well.
Very well, of course, because it's sweet.
You eat it or you use vitamin C. Then it will help the stomach acid to stop burning. Number 2, there is a plant called okra.
Okay.
Okra. It has a nice soup, which is thick, and it has mucus, which will build the walls.
Okay.
Food slides, no scratch. So if you are using it for 3 days, you'll find that there is no burn.
So for the okra, we should extract the juice from it.
Yeah, exactly.
Okay.
Okra is so nice. Or you can make a soup from dodo, nakati. Okay. If they are not polluted, you take it
daily.
Yes.
Okay.
Now, N95 masks. If you're in a very tight jam, you put
a mask on your
mask. N95, you'll find that 90% less dust swallowed. Okay. Lungs plus stomach rest same day. Okay. And less cough, less bloat.
Okay, so the cough also brings in the
Yes.
So the more you prevent yourself from the cough.
Yeah, you can. Where you see is very. Don't just say that I'm taking this. Okay. What else? Vitamin, zinc.
Zinc.
Yeah.
Yes.
The pumpkin seed zinc.
Okay.
Take daily. It will close the ulcer holes.
Okay.
The hole, when you reach that stage, ulcer makes holes there.
In the stomach.
In the stomach.
Yes.
But zinc is number one. Lead, mercury can't block healing, and 3-4 weeks, stool burning brown, not black. Okay. The stool will turn.
Will turn and come back to normal. Okay.
NSAIDs empty. Stomach lining stops bleeding. Okay. Blood count rises 3 weeks. No dizziness. Dizziness will go. Okay. Another one is H. pylori treatment. Yes. Kill the bacteria. First. Pollution has nothing to set on fire. Okay. 6 weeks pain. Your pain gone. Appetite back. Okay. Yes, and we are now understanding how we can link the two. If we follow the routine, yes, we shall prevent ourselves from getting the complications that come with ulcers. Yes. Okay, so doctor, can ulcers heal like completely and they are gone? I tell you, I had ulcers in 1986. You no longer have them? I don't have them. Okay. I don't have them. If you can follow the right methods of treating ulcers and know which part of your body has ulcers, what you have to take, what type of meals, cheaper. Okay. I've told you that today people are ignoring heavy metals. I repeat it again and again. Yes. If you have heavy metals in the body, you can come, we take your scan, we advise you which type of heavy metal you have. Is it copper? Is it other common metals? Mercury. Yes. But we can remove it. Okay. And it goes because you have to put what brings the ulcers, what causes the ulcers. I've talked about eating in time. Yes. Is also important. Okay. Eating in time. When you go to the toilet, you must see, are you going there comfortably? Okay. You have to, if you are still young, you talk even to your mother, to your parents. Mommy, I'm not feeling well. Okay, when mother will try to advise you, go and test, go to the doctor, go and make a scan, try to see, eat this. I've told 1 orange every morning. Yes. It will put back your mucus membrane. Oh. Frankly, okay. They are using it in other countries. And it's working? It is working. So it's something we need to discover as a country and we use it. Exactly. Okay. We have to try to advise people. We have to discover what we can do because Kampala is for all of us. Yes, of course. We have to use it and then you stay in a good life. Okay. Though they are making another city, but we need to use this city comfortably and have enough time to live. Doctor, are there any cases of ulcers re-emerging after they are treated properly? They appear again if we don't remove the cause. Okay. The cause always must be followed. Eating well, eating in time, sleeping for 8 hours, okay. Not taking warrage on empty stomach. The books are talking much about warrage, sorry. Not only books in Kampala, but all over the world. They are talking about it. Yeah, people taking warrage immediately when they are on empty stomach. Because we have a big factory, a big industry of the border. Yeah, of course. There are many in Kampala. Yeah, they need to be educated. I wish we are there. They can listen to you
And learn.
Yes, these are young people.
Okay.
We need them. They are making our country to go on productive. And I will tell you, when you use this method I've told you, the border man will make 20 trips instead of 10.
Okay.
The mama who is selling in Boga is going to come early. And no shame when you go to latrine.
Okay.
Because you know that you are
going to enjoy the process.
Exactly.
Yes.
Brown stool. That's the pride. Instead of black stool is the panic. You get me?
Yes, very well.
And then you bury the warrage, not the people.
Okay. So, Doctor, as we are winding, we see that many people in our country are suffering from stress, and also stress is some of the determining factors that influence to ulcers. What's your take on that? How do they link?
No, you are right. Whenever there is a bit of stress, it puts some juice in the stomach,
okay,
which is also acidic. People must not be stressed.
Okay.
They must know to do exercises.
Yes.
For 30 minutes. Do 30 minutes a day. Early in the morning, exercises are very important.
Yes.
Take enough water. Eat well. And go to bed early,
yes,
and wake up early. You'll find that you have taken the ulcers away.
Okay.
You have taken the ulcers. If I have given you these 6 points, what you should do, really the ulcers will go. They will go. When there is a place which is congested, you keep your... I always keep my mask here. I don't know whether you have one. After COVID, I'm keeping my mask with me.
With it.
Yes, when I reach a place where it is very bad, congested, pollution is there, I put it on.
Okay.
And I prevent that one from going to my stomach.
Okay.
Another thing I've seen young people are doing, they are taking this smoke, they are smoking. What is it called?
Shisha.
Yes. They should try to educate themselves. In fact, shisha doesn't get you who is taking it, the one who is around not smoking it. I've noticed. Because the person just gets it, puts it in the mouth, and throws it back to you.
People, yes.
To the people. He enjoys that throwing it back to you.
To the people, yes.
So, if you are around, you are going to take more of it
than the person actually
inhaling.
Okay.
Yes.
Okay. So thank you very much, Doctor. As we are winding up, what's your last take on ulcers and how can people prevent themselves from getting it?
No, I think you have done a good job. We need to continue educating them.
Yes.
Even going to schools, universities, because these are very simple points,
okay,
which people can take in. Some people are busy thinking of operation, being operated, when you can do it yourself. Others think that it is a chronic disease. How can it be a chronic disease when you are still 20 or 40?
Okay, of course.
Yeah. So we need to eat well, we need to do exercise, we need to sleep in time. We shall say bye-bye to ulcers.
Okay, as a country. Okay, thank you very much, Doctor. As we are winding up, please send greetings to people. Also share your number to the viewers if at all they would like to reach out and ask for more advice on preventing ulcers.
Oh, yeah, my number is 078 74 55 333. The good thing is a roaming number.
Okay.
Even if I'm not in South Africa, I'll get you if I am free and give you advice.
Okay.
Also, when I'm around, people can come to my clinic on Entebbe Road there, 3.5 kilometers from Kampala at Stella. I'll try to see One time I went to TikTok to help people, but the people were so many, and I lost a bit of interest.
So go on with it. Okay. But you also send greetings to people watching you?
Yes, people watching me, I send greetings to Dr. Mayanja always. Yes. Yes. My brother Sam Sewava there at Kansanga, and the wife. This one was international to my wife, I don't forget, in South Africa. I have another daughter who is in Dubai.
Okay.
I send greetings that she must do well there. And also I'm sending it to Dr. Grace. I'm sending it to Ruaga, wherever he is doing exercises. And I will not forget that I will send also to my friend Kano Muchwa.
Okay.
Yeah.
Thank you very much, Doctor, for that wonderful insight, and also for teaching us how we can prevent ourselves from getting the ulcers and how we can treat them if at all we have received them. To our dear viewers, we have seen that ulcers may seem common, but it is something that should never be ignored. So early treatment and attention and also proper lifestyle choices can make all the difference and help you to not get the ulcers. So take care of your health, and this has been your health show here at TV1. Let's meet again tomorrow with more information. Thank you. Have a good day.